welcome you all to the today's event. It's an honor to have a distinguished group of participants, which includes the heads of the schools, the heads of the respective department, and the students, who bring a wealth of experience and diverse perspectives from the across disciplines. Your presence today reflects a shared commitment to shaping a healthier, more equitable, and a more resilient future for all. Before moving forward, I would like to welcome our today's speaker, Dr. Ashish Joshi, the founder of FHTS. He is the Dean and the Distinguished University Professor of the School of Public Health of the University of Memphis. He is a visionary leader, a researcher, innovator, entrepreneur, educator, administrator, and a mentor. He brings with him a diverse experience of working across 12 countries, engaging community based organizations, academic, and other institutions from diverse backgrounds. He combines data driven, innovative, entrepreneurial, creative approaches to advance excellence in public health education, research, and practice that can have the greatest community impact. Dr. Joshi is a population health informatics researcher who combines his academic training in clinical medicine, public health, and informatics to design and develop human centered technology enabled interventions to enhance the population health outcomes across the diverse community setting. Before the session begins, we would appreciate if all the participants keep their cameras on throughout the session to ensure a more interactive experience with them. For any question or any kind of discussions, you may please share them after the session once the floor is open. And now it's my honor to invite our esteemed speaker, Dr. Ashish Joshi, to kindly enlighten us with insights on the reimagining public health in the 21st century. Thank you so much, sir. Over to you.
Thank you, Dr. Priyanka. Thank you so much. I hope I'm audible, right?
Yes, sir.
Yeah, thank you so much. So thank you all for taking the time and the effort to be this morning in India. I don't know what time is it right now, but maybe about 9 o'clock. And I, this is one of the inaugural part of the camp series, which is a career and mentorship program. We do all know that public health is going through a very uh, uncertain, unpredictable, and a complex environment around the global world. And I thought that this is a very important series to bring to you some fresh perspectives on how we can approach public health. And obviously, there's a not a definitive answer to anything, but it also shows that we have an opportunity to share some of the perspectives that might be critical to at least share the knowledge with you all that allows us to engage in a meaningful and insightful dialogue. So I hope that your next 45 minutes you find it something which is engaging, enriching, and insightful. And this will be a monthly series that will get started on topics that maybe very traditionally we don't talk about public health. So I will definitely give last 15 minutes for questions and answers, and you feel free to reach out to me. So I'm going to make this as a slideshow. And if you let me know if my slides you can see moving to the next slide. Dr. Pranka, can you see my slides moving to the next one?
Yes, sir.
Okay, sounds good. So just the presentation outline, what I wanted to have is briefly about myself and uh, why this series is so important and why public health is more important than ever before. And what are some of the challenges we do see currently in public health and some of the approaches that could address on how to respond to these challenges, especially in the current environment what we are living. I'll give you some examples of the SMART model and its components, talking about some of the innovative approaches to address those. I talk about a very unique model of public health education into high schools. This is one of the first national and international model where public health education has been brought to the high schools. And then what are we doing in terms of research capacity building in undergraduate education? The role of public health diplomacy, advocacy, and emotional intelligence in the current public health to prepare the current public health cadre to respond to the current needs in public health. some of the digital applications, and then what way forward. Um, this presentation, what was motivation behind this presentation was largely that we are living sometimes in a world of epidemiology, biostatistics, surveillance, immunization. But there are some other aspects of innovative approaches that can be taken that could actually look at some of the root causes to address how to address the root cause of public health challenges. Dr. Priyanka, can you see my slide if I'm moving?
Yes, sir.
Okay. So let me know if there's any kind of and if you have any questions, just put this in the chat, and I'm sure that the moderator, Dr. Priyanka, would be able to help it out. So I'm the dean for the School of Public Health at the University of Memphis. But more than academic credentials, I always like to talk about myself in a very non-academic way. We all come into public health. I'm sure that all of the profession people who are here are coming into public health for a particular reason. We have to have a passion to create impact. So public health is not a 9 to 5 job where we just come in and walk in and we think that it's an administrative position and it's an easy, cozy, sitting in an office job. But I think I always define public health as more like a calling. It's a mission. And you always do some calling and mission when you have a life with a purpose. And the third aspect, which is very critical, is giving is a blessing. So that means if you have a knowledge, the knowledge is not to keep to yourself, but to really disseminate. So I just wanted to start with this positive kind of an aptitude that passion, purpose, and giving is a very important element in public health. And somehow we are living in a world of data and quantification so much that the human connectedness has been missing. So I think it's an opportunity for us to a little bit reflect back on the human aspect of public health. A little bit about myself, some of you may have known. I think I've been giving a lot of topical lectures, but I think this is more like an interactive session and a dialogue. And so, my journey in public health is, as as a traditional clinician, I'm a physician by practice and practicing in India. It's been 23 years I've been in the US now. Um, I learned about evidence-based training as any other clinician, whether you are in a dental college or a medical college or in a pharmacy or physical therapy, no matter what, we are taught about evidence and how do we really bring evidence into practice is through the lens of public health. So in 2002, what really at that time public health was really viewed as a stigma, to be honest, and I'm pretty going to be honest about this, is that if you can't do clinical practice, you go into public health. But for me, the coming into public health was really to look at population and prevention. Like patients coming to the hospital all the time, the kids coming to the hospital, and we are just writing prescriptions, and then they keep on coming, we keep on writing prescriptions. Not that we don't have to have a clinical care, but I think it was very important for us to really understand that how do we prevent kids coming to the hospital or people coming to the hospital, which means prevention at a population level is a very critical component. So I pursued my master's in public health from Boston University in 2002 with my majors in epidemiology and biostatistics. And I'm talking to you in 2002, and one challenge was there that uh, at that point, probably if you may recall, like internet and computers were just coming in. So I hardly had any knowledge about computers or technology. And I soon realized that, your biggest limitation can be your biggest strength sometimes. So we keep on saying that, oh, I don't know this, I don't know that. Uh, but I think sometimes the limitation becomes a strength. And I'll give you an example in how it transformed my career was that when coming to the US, I found that people who are really tech savvy, they were really good, but they did not have the clinical acumen. And when I found that as a clinician myself, I don't have a technology acumen, that's when I decided that if at any point I get a chance, I'll pursue my PhD in informatics. And that's what motivated me to go into PhD in informatics. So that means you have a clinical training, you have a public health training, and you have an informatics training, and that allows you to connect the dots. And public health today requires individuals who know how to connect the dots. So it's not a linear thinking, it's a systems thinking approach. So I bring this context to your all my audience today is to let you know that yes, you might have a physiotherapy, you might have a bachelor's in dental surgery, you might be coming from social work, and then might go into public health. That does not mean that you need to disregard your background of the basic information and the education that you have got. So you always build upon the education what you receive. And that's what really motivated me to go from clinical training to all the way to public health to informatics. And the goal was not to do just do research. We often use the word research in a way that we have to write publications, we have to write books. But to be honest, it's not about just research, it's about translating research into practice for a greater community impact. So if our research, what we do, cannot be translated into practice or cannot be for the benefit of the people at large, then this is my personal opinion, there might be disagreements, that's perfectly fine. I strongly feel that that research, which is not meaningful and cannot be translated, has some does not have that enough relevance. So we need to come up with public health research and applications that are sustainable. That could be multiple sectors, which means if somebody wants to be healthy, they need to have affordability of a good healthy food. If somebody we expect to have and go to a doctor, they must have an employment so that they can afford to go to a doctor. We need to come up with solutions that are accessible, affordable. If I'm going to tell somebody that this app works on an Android and an Apple phone, and somebody's saying, I have a basic phone, I just don't even know how to text. So that means technology just cannot be, uh, just like a cell phone. It has to be something that is usable. And if I'm spending something, then I should get the better quality of life and quality of services. So that's reimbursable. And tailored means that not everything will work for everybody. So we must focus on tailored and targeted interventions. So that's kind of my academic and research rationale. And which means how do you integrate clinical training, public health training with informatics to create smart solutions? You all can see my slides, right? They're moving because sometimes I've given lectures when the slides are not moving and somebody says, "Oh, I'm not seeing your slides moving." Dr. Pranka, can you see my academic and research rational
Yes,
slide,
sir.
right?
Yes, sir.
Okay, great, great. A lot of time people talk about public health education, and I'm of opinion that public health education cannot be just done in the classrooms. They come from lived experiences. And when I say lived experience, which means that each one of us today has some experience of public health. We may not call it public health. For example, somebody traveling in Delhi for 1.5 hours and kind of facing the challenge of transportation to reach to the work environment. That's public health. If somebody is not able to get a healthy meal or healthy food, that itself is a public health. So, a little bit about this. I've worked in about 12 countries across 8 multiple languages, focusing on digital health interventions. Really worked across almost every possible continent you can imagine, like Middle East, Africa, Europe, Latin America, Central Asia. And I bring this context to you because obviously today the audience is an Indian sitting, but I do engage a lot of people in Middle East or in Africa. The problems wherever we are kind of very similar. Of course, the quantification, the intensity, and some of the root causes of the problems can be different. But the obesity is an obesity, whether it's in Nigeria or it is in India. But what is causing obesity might be a little bit different. So we need to understand what the root causes are of those problems. In that context, my focus has been building on smart labs. I'll talk briefly about the smart model. Uh, I describe my journey as more like an educator. And normally, when you are doing your master's or PhD, you never think that you will become an administrator. We always want, we are going to become an educator, we are going to teach, we are going to do research. But sometimes we don't think that public health professionals can play a very good role as an administrator. But in the 21st century, we must work as an innovator, and we must think about creativity and out of box thinking. And recently, I have been talking about public health diplomacy. That's a very, very important component. So, whether you are in a job environment, whether you are in your college as a student or as a faculty, or whether you are working in a non governmental organization or you're working in a hospital setting, in everyday practice, you do have to have the skills of negotiations, consensus building, problem solving, critical thinking. So, those are kind of the skills that do require for you or us to succeed, irrespective of the skills that we might have. And that's where the concept of public health diplomacy comes in. In my last 15 years career, I've secured about $25 million in research grants so that I can at least let know that I'm not just coming here to deliver lecture, but I've worked in almost every possible toughest environment. So everything is coming from very lived experience. Published more than 150 papers, developed the first Master of Science and PhD in Population Health Informatics, the first public health diplomacy lab. And then what I'm very excited to talk about today is the model of public health education in high schools. That's a very, very innovative way. So if we want to address the issue of obesity, if we want to address the issue of diabetes, hypertension, we can't wait for people to come to the college, graduate, do the job, eat unhealthy, and then become actually a diabetic or hypertension. These behaviors start very early in our kind of age trajectory. So that's where I'll focus this talk today around that. Of course, I'm very humbled and privileged to be on the board of directors of ASPPH and very proud, like as an Indian American, to represent at that body that helps guide actually some of the policy making in the US around the Association of Schools and Programs of Public Health. Uh, I've loved travel, I've traveled more than about like now 45 countries around the world. And that's when I say that this talk or any other talk in the future or my career has really been built with real lived experience. And that's why I call public health journey through lived experience. You need a little bit about what we're going to talk about is uh, to improve health and well-being. It's not just taking care of good health through healthy eating or physical activity. We must focus on the social, physical, and economic environments. Those are critical components. So I'm not sure if you've heard, but the social determinants of health is very important. So, for example, if you're living in an environment that does not allow you to go out and have a good walk just because the infrastructure is not there, that will kind of impact your good health and well-being. On the other side, if your job it's very stressful, that creates a kind of a mental impact. So there's an emotional aspect of the well-being. So I think to have a good health and well-being, you must have a social, physical, and economic aspect of that, and that those are critical attributes to having good health and well-being. We can't just say you should only eat healthy but then not sleep. Oh, you can sleep well, but then not eat healthy. So it's a kind of a system dynamics that we need to take into account. Uh, why public health is important than ever before? This is extremely important that why we are talking about public health. There is a very rapidly changing social, political, cultural, and economic norms. We are living in the world of misinformation. Information is all over the place. And so that means there are external factors beyond our own control that are actually the drivers of public health today. So, how do you really address those drivers? Is not just through research or just through education, but you also need skills that are beyond that, which means you have to be an effective communicator, you have to have a good systems thinking skills, you need to have good leadership skills, and you must know that, in a very complex environment, how do you really adapt to that environment? We can always keep on blaming the system. We can always talk about complaining about the problems. But at the end of the day, we need to a little bit adapt ourselves to start thinking about creating solutions. So Focus is now more on population health and social determinants of health, which means the uh, health care is not limited to the hospitals or to the health departments, and in Indian scenario to the NHM or the urban health uh, councils, whatever you want to call it, urban health centers. This is way beyond. So self care is a critical component. Self management is a critical component around that. So changing workforce needs. It's very common now what we say that we need to prepare students for jobs that do not exist. At ASPPH, I like to quote Dr. Laura Magania, who's the president of ASPPH. She said, we need to prepare the students and the workforce for the jobs that we don't even know that what they exist today. So there's a very rapidly changing workforce needs, and we must be aware about what those workforce needs are, so that if we don't change our curriculum the way we are teaching our students, uh, I'm not hesitant to say that they will be lagging behind. So globalization is a very important aspect, which basically means that not only we are living in a local world, we are very connected to the global world. So obviously, a lot of times we talk about global health, and it's very rare I've seen presentations that talk about local health. Global health looks very exciting. People get excited about the term. So everybody wants to do global health. But I think the real good health begins from your backyard. So I think we need to focus on our local context, and then connect the local context to the global context. And that's where I call this the term globalization. We need to talk about solution centric approaches. We can't just do cross sectional studies. We can't just look at what is the burden of diabetes in the population. Of course, everybody knows what's the burden of diabetes. It doesn't matter whether somebody says 5% or 6%, but what people need to know is what are we doing to actually prevent that burden of rise. So I think we need to focus a little bit on the solution side of the things. Uh, I know we talk about public health workforce. And I always like to use the term public health leadership. So I think we do need to prepare public health leaders and not just a workforce that will go out in the community, collect the data, do data collection, analyze the data, sit behind the kind of a desk. But we do need people who are front runners, who are leaders, who are forward thinkers. And to be honest, they have to be bold to take the risks when they are making informed decisions. So I think it's very important to have a leadership which is creative skills, which can cope in a very difficult environment, which can adapt and be resilient and empathetic. And one of the things we talk about in public health right now is a resilience curriculum. How are we teaching our students to be resilient? I leave those questions with you all as I go through my presentation, because that is something that we need to reflect upon, like what are we actually training our students with today? So obviously this gives you some context about some of the 21st century challenges. Earlier we used to talk about epidemics, and after post-COVID, we are talking about the term pandemic. Like nobody thought about infectious diseases. We were focusing only around chronic diseases. And all of a sudden, we are starting to see an emerging infectious disease burden. Expanding access to medicines is a critical component. But what is really also important is keeping our youth safe. And I have come to India almost for the last 13 years. I don't know, maybe on an average a month or 2 months every time. And what I really heard over a period of time, and I've witnessed myself, that the engagement of the youth in very high risky behaviors is a very big problem. So, how do we really engage the youth? How do we really build public trust? And how can we use really technology to address all these complex challenges that somehow are linked one to another? So that means we can't have a singular approach of intervention. We need to think about a more like a systems approach where multiple factors can be responded to in different levels of intervention. So there are some innovative approaches that are being taken in areas of public health. I just wanted to give you some key context around that. digital health technologies. We keep on talking about the word artificial intelligence, but I strongly believe that AI is just a tool, it's a calculator, it's an enabler, it's a catalyst. But at the end of the day, we do need to know how to apply those tools to improving the health and well-being. So it's an application component of that. Genomics and precision medicine is a very important element. How do you really connect to the basic science to the population science? So sometimes we go in the field of genetics, and then we say, okay, can I do public health? So I think there's a ample amount of evidence and must be done now is cross-institutional, cross-sector collaboration, and that must be introduced in the curriculum. So I think we can't just keep on teaching students about epidemiology and biostatistics and not show them how there are linkages that could be established across the basic science to all the way to the population science. So we need to have that understanding about those particular aspects of that. Integrated care models is another approach. We must be able to link the primary care, the mental health services, and very, very importantly, sometimes we ignore them a lot, is social services. How do you really navigate healthcare? So this is a model for care continuum and care coordination where multiple services come together to address the health and well-being of an individual and as well as the population at large. Rather than using the word artificial intelligence very loosely, I try to talk about application of artificial intelligence in public health, and that's a pretty important element that we should not just talk it about, oh, let's teach you about R or just teach you about Python, let's teach you about statistical tools, but at the end of the day, nobody knows how to apply those tools to the real data when the real data comes in. So as I walk through this, I'm just trying to make a case of why public health in the 21st century is an important element. And what's the role of policy and governance in public health? We need to focus, of course, more on preventive public health strategies and actions, not just focus on preventive healthcare, but really focus on strategies and what are the actions that we can do to prevent actually the public health challenges that we see today. We must have an effective public health governance, which is essential for sustainable impact. Uh, the health system strengthening has to be done, but it cannot be just done like by its verbatim. There needs to be a proper infrastructure. There needs to be an adequate funding support. There needs to be a trained workforce that can actually execute and implement these things. How do we implement evidence-based policies to address health inequities? And then cross-sector collaborations, cross-institutional collaborations are critical. Many times we ignore the private enterprise, but in my opinion, the private enterprise plays a very, very important role in also contributing to addressing the public health challenges through its collaborations with academia and its civic society and non-governmental organizations. So, as we are talking about these challenges, I want to give you a little bit of a backdrop on the approach about SMART and how we are using that. So that gives you some kind of an real examples of that. Uh, Sustainability is a very important element. I am sure, like in the US, I've been here for 23 years, and as a dean for a school of public health for the last 3 years, of course, in my role as a dean. I can tell you that uh, I have gone to almost any and every possible community outreach that could be possibly done. For example, strong collaboration with the health department, strong collaboration with the school systems, strong collaboration with the neighborhood community centers, strong communication with the churches, strong communication with the city council. And to me, that's what public health is all about. Public health is not about just going out and working for an NGO to collect the data. It's not about that. It's about how do you go and apply public health skills, knowledge, competencies at a very broader level, which means going to schools and teaching the students about social media addiction and why it is so important to not to get into that is public health issue. It's not like, oh, let's leave it. If they come to public health, then we will only respond. No, that's not the case. Then you have people who may be great sportsmen. They might be a great basketball player, they might be a great volleyball player, but if they don't know the importance of sleep, the importance of food they eat, the importance of how to cope with failure, that's public health. But as I told you, I'm going to leave these questions to you of how many people are teaching all that as a part of the curriculum. And that those are key. You can be a very skilled person, but if you don't know how to respond to the crisis, and then yourself going into anxiety and depression, that itself is a public health challenge. So my argument, what I'm trying to make is that we need to think about public health in a very different context now. And I'm going to be very brutally honest about that. So we need to talk about multiple sectors, which means sectors that cut across completely different dimensions. Uh, so this gives you some context of how this has been done, and I'll give you three scenarios where the University of Memphis School of Public Health has done what it has tried to really operationalize, not just this framework because it looks very nice in a PowerPoint, but how do you to really translate this into practice? So this model is built upon three pillars. It's built upon the data that we gather, and it's not about just collecting the data. It's about collecting the right data. So one thing is about collecting the right data, and thing is about collecting the data. So there's a difference between that. What level are we collecting the data, and what are the dimensions of the data what we are collecting? So a lot of time we immediately go and teach students about meta-analysis, systematic review. And I always tell them that before you even do that, we need to teach them formulating a research question. You can't formulate a research question if you immediately go into a systematic review, because systematic review is an exploratory process, but it is still guided by a research question. So there has to be some hypothesis to that. So I think we are like we are in a alphabet level. I always say that we are starting at D and we have forgotten ABC. So we must start at A before we start going at D. The second component is what are we doing with the data that we've gathered? And a lot of time we teach students about logistic regression, descriptive analysis, frequencies, but what analytical approaches to use in what data to derive what questions and answers is data intelligence. So there's a little bit of a difference between data analysis and data intelligence. So I think we do want individuals who are not just able to run a tool, but who can translate data into meaningful and insightful information. And that's where information comes in. And once you've found the meaningful information, how do you apply that information into knowledge that could apply towards policy making, design of interventions, or any kind of outputs that could help you shape the improvement of health and well-being. And that's where the SMART model comes in. It's a very human-centric approach. So, for example, I need to know who my users are, and I also need to know what the users want. And sometimes we create programs and we take it to the users, and the users like it, but they don't continue with them. Why? Because they are not co-creators to that. They're not co-designers. And that's where the human-centered principles comes in. So in public health today, where the information overload is so much and misinformation is so much and the youth is so tech savvy that almost the information burden has taken their life. So unless we ask them what they need, we might be giving them the information that might be not very relevant. It's a middle out approach, so which means, of course, as much as it's important to work with the political spectrum and the policy makers, we also need to work with the communities. I am of the opinion that almost every single student just should not go out in the community to collect data for the requirement of the practicum or internship or experiential learning, but I think they need to understand the needs of the community. And that's a very big difference. So understanding needs is different sometimes from just collecting a data on a particular problem. How do you approach the community? How do you really build trust in a community? How do you really build trust? Like that's a key element. So I think we need to start focusing a little bit on a middle out approach, which means intersectionality between the policy and the community. Both have to be done at the same time. Uh, the third pillar, which is very important, is like, of course, we talk about data-driven and evidence-based policies a lot, but they have to be driven based on community participation and engagement. So if I say, okay, in a particular geographic setting, there are of the 100 people, 40 of them are diabetic. But the question is, what do they want? It's not about how many of them are diabetic. It's not how many of them are hypertensive. It's about what do they want and what is causing them to be diabetic. And are we, after the survey data collection, responding to the needs of the people? Or are we just doing research because we love doing research and we need publications, we need books? And I think in public health, we need to start focusing on greater community impact. The fourth pillar, which is also very important in SMART, is it has to be very dynamic and flexible. We can't be fixated and rigid in our approaches. So in public health, the beauty is that you can be very nimble, you can be very agile. You can always use the building blocks and then use those building blocks to cultivate something that might make relevant in one environment, maybe make relevance in another environment. And the last pillar I always say is we talk so much about the burden, but really we talk about the solutions to those burdens. So hopefully in my third phase of my presentation today, I'll be able to give you some examples that will tell you on how we are approaching this situation about public health in the context where I am right now. Uh, I use the word hub, and somebody says, okay, yes, this is fine, but how do you do it now? So I'll give you some example of like literally a tutorial on how we are
मैं एक
approaching
छोटा
this.
काम करो क्योंकि के पावर पासवर्ड लीला का है
I
Yeah,
request
if anybody is there, Dr. Priyanka, you need to mute them. This is a very basic core ethics of a presentation, you know. So pardon me for being a little bit honest about this. Uh, if the things are not working, that means there's something wrong we are doing, which means we need to reflect, reassess, revise, and refine. So it means if we all know that the burden of diabetes is increasing and we are all aware of that, and still it is increasing, that means we are doing the same thing again and again. There's something fundamental wrong. So if we are expecting that the outcome is going to be different just because we are doing the same thing, frankly speaking, like, it doesn't work that way. So we have to be innovative. So that means if we're teaching students today the epidemiology or biostatistics or health policy, social behavioral, we must teach them about innovation. We must teach them about not just startup, but we must teach them about how to sustain an organization. So rather than just saying, I'm going to just find a job, how can you create a job? So it's a very important lens. So I call this as a community-based research solutions. I never use word research alone. I don't think I've ever used the word research alone. I try to use the word research-based solutions. So if we are going to 100 people and saying, give us your data and we are going to analyze it, we are going to do it, and then we never go back to translate those into anything. And that's where the mistrust comes in. So this is a kind of a hub, and it's a virtual hub. You can call it a digital hub, you can call it a physical hub. But imagine you have a 200 square feet space, and that 200 feet space kind of provides preventive healthcare, social services, mental health services, and all in one umbrella. And as a matter of fact, even employment. So that's a key component. So I wanted to share with you 3 years ago when I've been here for a long time now, and as a member on the ASPPH, one of the things which was very dear and near to me was to bring public health education to the high schools. There's no way that this would not be done. And it's not easy, I can tell you that. It's absolutely not easy taking public health education to the high school. I was told it's not worth it. It's not going to happen. There's no curriculum. It's almost, why would schools even do? I'm very, very delighted to share with you that we are the first school of public health in the nation and in the globe that has brought actually credentialed public health education to the high school. We are not just doing camps or health awareness and all that stuff. No, no, no. As a matter of fact, we are teaching students on social determinants of health and health disparities in grade 10th. We're teaching global health crisis and milestones in grade 11th. We're teaching informatics and analytics in grade 11th and 12th. So we are the first school, and this model now is a national and a global model. We just published a paper. We got the highest award in the country here of taking our model into high schools. And I'm very proud to share that there are two collaborators with us in India that we have been able to execute it in the school levels. One is in Greater Noida, and the second is at DAV University. We're very, very delighted to share that. It was not easy. I had a lot of like pushback. I've spent 10 years, frankly speaking, and many times a lot of people will not even ask me to come and meet until unless you get a title, you become a dean, then somebody will listen to you probably. But I think I don't know who my audience is today, but if you are listening out there today, you must have the conviction that you are going to make the change, irrespective whether you are being heard or not heard, does not matter. But public health cannot be done at a graduate education or an undergraduate education. Risky behaviors are getting formed starting middle school today. So if we are not going to intervene at that level, I don't know. I'm very excited to invite you all to partner with us in this initiative. This initiative is now in about 14 countries around the world, and it has just got recognition by the United Nations Academic Impact Partner. So we are very, very delighted about that. Uh, this is a pathway. We are the first school of public health where you can actually go from all the way high school to all the way doctorate education. It's not, there's so many universities now that are trying to emulate this model. If I tell you like it's easy, forget about that. Is it doable? Absolutely, it is doable. So students can walk from the high school to go to all the way to undergraduate. And as a matter of fact, we are now the only school of public health that offers undergraduate certificate in public health to the students who are in grade 11th and 12th. So you can imagine the level of public health education that has been brought to the high school level. So this is a framework that we are using. We are now in about multiple countries. In the US, we call this as a concept of dual enrollment. I know in India, this concept is not there yet. Uh, so high school students can take up to 30 college credits. 30 college credits even before they have completed the grade 12th. As a matter of fact, that tells you that they've saved almost a year and a half before they do. So there are a lot of these initiatives that we've started from all the way from public health clubs to all the way to public health change makers. This is a very large grant funding we are giving to our students. This is on almost on a tune of like an undergraduate student at our school is now receiving I don't know if I don't know the conversion rate right now, but I think it's about now 60,000 rupees that we are giving to an undergraduate student alone to find a solution to the public health problem. And we are investing almost, I would say, around $50,000 for our students to come up with solutions. And that's a big deal. And I invite anybody who's on this call, I have no clue who the audience is, to partner with us because we are really looking forward to this framework to really, and I really want that this something to, like this to come to Indian scenario. We have very strong partnership right now in the entire Eastern, Central, Southern Africa. We have partnership in Middle East, Latin America, South America, and it tells you, even as a matter of fact, Croatia, Kazakhstan, Central Asia. But these are the reason is why students don't know this. They just don't know that this is public health. We can actually do a random sample of a survey, and I'll tell you, people have not, they know they want to go to medical school, they know they want to go to engineering school, they know they want to go to law school. They don't know if what public health is. So these are our participation schools. We are in Algeria, Georgia, India, Indonesia, Kazakhstan, Malta. And I started this 3 years ago with only 4 students. Only 4. And I think, if I'm not wrong, I hope you don't hold me accountable for my statement, what I'm going to say. By the next 6 months, we'll be in about 78 countries. And that's what we are hoping for, that we should be able to connect the students all over. So these schools are currently participating in our curriculum. It's not hypothetical, like, yeah, we've just come up with that. No. We have first 8 students graduating from our undergraduate certificate in public health at a high school level. Just imagine being student taught about analytics and informatics at 11th grade. And so it's very doable. These are our participants. We are teaching. It's about our public health in action. It's an experiential learning program. We've just launched this program in an Indian scenario recently. So the last kind of a second component. So my one focus is youth. The second focus is, we need to tackle global health threats which are happening. And you're all, I'm sure you're all familiar, the challenge of COVID-19 when happened, the vaccines were not being distributed equally to different countries, even though that there was a treaty signed. There was a treaty signed that if any case of a pandemic happens, the vaccine distribution will happen in a way that it will be equitable to across the world. But that was not the case. So that means diplomacy plays a very, very important role. And whether a lot of people ask me question, what's the difference between advocacy and diplomacy? And I always tell them, advocacy happens in the face, diplomacy happens behind the camera. So you do need both, but there's a third element what you need, and that's called emotional intelligence. So you must have emotional intelligence combined with advocacy, combined with diplomacy. And sometimes we are very reactive. If somebody tells us something, we so quickly react. We get very egoistic, we get very hurt. But in a world of public health today, you have to be very diplomatic. You can't be just taking it very personal. So I think to the larger good of the people, we need to have understanding that diplomacy also does not happen through just traditional channels. It is also people to people diplomacy. There's a language diplomacy. There's a cultural diplomacy. There's geographic diplomacy. There's a geopolitical diplomacy. But public health diplomacy is also very, very important component. So we need to have a commitment to local, regional, and global cooperation. Communicate, if effective communication is a very important component. If somebody tells us, like, what is the one skill, I said, yeah, health communication is a great training program, but it's not the science of, we need to have the science of health communication. It's about, can you effectively communicate? Effective communication is a very, very important element. Sometimes you have to come in the media. How many students are trained to go in front of the media and to talk about measles? Think of a way. We are not training that. So if you in public health are not being taught to be a communicator. You can't be in the competency of public health. You just can't. So, and it's also not about communicating complex jargon. You must know how to have a persuasive communication. So a lot of time when I sometimes interview people for jobs in social media, they say, "Sir, I know how to post social media posts." No, no, that's not what I'm looking for. I'm not looking for somebody to post social media. I'm looking for somebody who knows how to engage social media. So social media engagement or communication is a very different element. And how do you really be persuasive? How do you really translate very complex quantitative numbers into a way that somebody can easily understand who has no understanding of the computation or the numeracy aspect of the things? And you must know how to work with different sectors, you know. Sometimes I ask a lot of, like, I think we have interns in our incubator probably from 200 like institutions right now in India. And I ask them, so which other sector have you interacted with? Cross sector. Must. It should be a curriculum component. It's one of the competencies here in SEEF that for improvement of population health, students must demonstrate competency of working across sectors. Those are key components. If you want to make your program unique, you must be able to deliver a very comprehensive competency based education program. And that's where, to address all these things, there was a need for public health diplomacy. Uh, there was no such term, public health diplomacy. Let me say that. Uh, I think before I go to the slide, let me tell you how this is useful. A lot of time you've heard the word global health diplomacy. People love word global health, you know. But global health is a very Western term. And if you look at the origin of global health diplomacy, it's very West specific. And if you use the word health diplomacy, it's very Geneva centric. But then there is a context of local understanding, and that how do we bring the local context? And public health is about local. And if you have to engage with your bureaucrats, or if you have to engage with your policymakers or your politicians, you're dealing in a local context. So that's where public health diplomacy comes. So you can't implement global health diplomacy in a very local environment. You have to bring the local context in a local environment. So I think that's where public health diplomacy comes in. Public health diplomacy can help in facilitating collaborations, coordination, cooperation, communication. So I call this 4C model. And of course, I'm not going to go through every single bit, but it supports sustainable development. But largely, what the goal is to achieve fair, please underline the word fair, equitable health outcomes so that we can address health equity, better health security, and population health. And that's where public health diplomacy comes. And to address this challenge, in 2024, uh, I was able to go to the University of Memphis leadership and request for a funding to establish the nation's first public health diplomacy lab in the US and abroad. There was no term public health diplomacy. So obviously, the first challenge is how do you really counter so many diplomacy terms that already exist? And how do you really make it differentiate enough that there's a buy-in and that there's an adoption of this terminology? The second component is that global health diplomacy and health diplomacy were the words that always came out of schools of international affairs and foreign relations. So from that context, I think I was probably at the right time. It was the right place, right moment. Got the funding. We built the first lab. And rather than me defining public health diplomacy, we said, okay, who are the actors in public health diplomacy? You need people from law. You need people from management, international affairs, technology transfer, tech transfer. Can you imagine artificial intelligence as a diplomatic tool today? We must teach students how AI and technology transfer is a diplomatic tool. And how do you really bring trade and related policies? Trade is a diplomacy. Economics is a diplomacy. And then we expect public health people all of a sudden to have a say at the table. And frankly speaking, if you're not even in the menu, you're not going to be at the table. So to be at the table, you need to have the ecosystem, broader understanding of what this requires. You don't have to be an expert in everything, but you must know who to bring at the table so that you can bring the best around you. And that's what public health experts need to be in. Who to bring at the table. I don't want to become an intellectual technology transfer, but I should recognize that to make me successful, I need people with the intellectual technology transfer around me. So I can't be everything, but I should know who else I need to bring around me as a public health professional and practitioner that will help in that. So finally, it was an amazing moment for us. We did our first inaugural public health diplomacy summit in the city of Memphis. Nobody could have imagined that in Memphis a diplomacy summit is happening. Uh, Over a 3 day period with 29 experts, 15 countries that I did not choose, with the support of Global Network of Academic Public Health. If you are not aware, you must know about that global network. It represents about 100 countries, 500 institutions, seven regional public health associations, all came together, and it was. I'm very grateful to ASPPH, our national body, and to the president of ASPPH, who supported this endeavor. And over a 3 day period, we came up with the definition. Every single word was intentional. Where to put a comma, and the fact that this definition was unanimously 100% agreed upon showed the first outcome of our public health diplomacy effort, which means that there was a consensus definition. And when we say it's a multidisciplinary field where we want practitioners to effectively communicate, facilitate, negotiate, and build consensus using system thinking skills, evidence based approaches, community informed, value based system, you know, based on equity and human centered values. So, as of April 2025, this is a published paper, and currently, this is how public health diplomacy is defined. And I'm very humbled to share that we were able to be the pioneer in defining this field actually from the lens of public health. Uh, this is our huge gathering. I will tell you definitely, we brought all the political aspects, the policy makers, the all regional associations around the world in for a period of 3 days. World Health Organization, World Federation, and we had a representation. And these countries represent not just a country, but they represent seven regional public health associations. So it's not like anybody, oh, because I knew somebody from Germany, I invited them. Not at all. This was recommended by the regional associations of public health. Uh, so there were key findings. I really want you to look at this very carefully because we know where we are going next. This concept now has grown. We are now, I just came back from Berlin and then in Gastein where we presented this. We have trained about 60 scholars from the entire European Union and the European countries to understand why public health diplomacy is a critical component. Our second summit is upcoming in March, and this is the time when we will be inviting the health ministries, the foreign affairs ministers with the schools and programs of public health. So you're going gradually by bringing these multiple sectors. And key things came up. If you look at this, cross-cultural communication, do we teach that in public health? Crisis management? No. How to even build trust in a community? How to identify infrastructure building for collaboration? What do you need for collaboration? I can't just pack up my bags and come to India and say, I'm going to do research in India. There should be trust there. I can't just walk into any community and say, oh, I want to collect data on you. No, it doesn't work that way. How do you build uh, empathy in the curriculum? How do you really build cultural competency into that? So those are key things which came out. This is a paper that got published. It has representation from multiple authors. And last part of my presentation is, I think I'm absolutely in my time. I think I feel that I should be done in another 5 minutes and then I'll open. So obviously this is our incubator. I take a lot of pride. 13 years ago, I started this with $400 startup, and there was it was a vision. And but I like to mention some of the people. I don't know because I can't see the screen, but there were some very early strong believers, and I would be doing injustice if I don't tell them. Uh, I had a I was focusing on informatics, and there was one of the faculty with KLD, Dr. Mubashir was there. I don't know if maybe she's there or not there. I have no clue, but I just want to acknowledge her if she's there, or at least, like, she was very gracious enough to give me the opportunity to at least listen to her, and I had a great chance to meet with her at KLD. It was very early in my times when not many people believed, and hopefully she was one of the person who thought that what I'm doing something makes sense. And then from ICMR, it was Dr. Katoch, who was Secretary DHR, very, very kind enough to give a chance. Dr. Ashok Grover was there. My team, very early team, from FHTS, who there was Kanda, Bhavya, Shruti, Mehta. I am Dr. Mohan. And then lately we have Ashruti, Mansi, and there are many now people who are there who've been there. Like a lot of people, I don't remember even the names now, but I do remember them from my heart. But I do want to take a moment to acknowledge that no organization is built until you have good people around you. So I want to emphasize that public health is not about individual, it's about collective. You can't just talk about yourself as a public health. You want to build a good system, you want to build a good organization, you must have a great team. You must have a trust in a team. Trust, loyalty. I will highlight those things that at least have built my career over here, and I try to infuse that again and again in our team over there. So that's how foundation started in 2012. It's been 13 years. I was told whether it will sustain or not sustain. I said I don't know about sustainability, but at least I do know what my commitment is to that. So it's been 13 years to manage it remotely. We don't have a boss, anybody there. It's a very horizontal structure. It's a DSAR certified. And if you look at the organization, I never said that we'll do public health. I said we'll focus on 4 areas. There's a mismatch between education and employment. There's a mismatch between job and a career. People are looking for job. I never hear people saying, I want to build a career. They say, I'm looking for a job. There's a difference between a job and a career. Job you get to survive. Career you build to thrive. So there's a difference. There's a difference between teaching and mentoring. So we can be a great teacher, but we do need a very strong mentor. And the fourth thing is that, of course, we can talk about problems, but we need to find solutions. So that's what we've been focusing on. I'm not going to go into the mission vision. You can go through the website at any point of time. Uh, just to give you some snapshot, we focus on very forward-looking, vision-oriented areas that will help us a little bit be ahead of the game. I don't want to be in public health education. I want to be public health 1.0, 2.0, 3.0, 4.0. We should be able to operationalize what we're doing and just translate it into practice. So these are some of the domains we are working. There's 7 funded projects. We've done 35 separate projects, 80 plus publications. But just last week, I for last 6 months, we've been thinking about, like, let me put entirety of the 13 years together in one place. So we launched a new website, and the website is a very sometimes aesthetic term, like you present so much. But I encourage you to go and see that for the first time, uh, all 13 years of work has been visualized in one platform. So if somebody says, okay, what have been done? Our community outreach has been through 1,600 approximately events at 400 unique venues with 600 plus camps, 18,000 beneficiaries, and we have currently 773 interns that we've mentored with 1,760 students currently enrolled. That means the power of data, the passion. Has it been easy? Not at all. Not at all. It takes about 17 hours flight to come from the US to India, 17 hours to go back. And sometimes a lot of students will reach out to me and say, can you tell us like how can I come to the US? I want to do this, I want to do that. No, you have to ask people the journey. Don't just look at the outcome. You must know the journey of how that outcome was reached. And that's why I focus a lot on the process rather than on the outcome. Outcome is not going to be always favorable that what you're looking for. It's not going to be there. I invite if there are some faculty or any institutions who are here listening. I strongly believe that in India we do need a collaborative researchers group. You know, we started this. We have now at least 20 partnerships and 20 meaningful partnerships. I always tell them that these are not partnerships which are on piece of paper. These are close bonds to whom you can trust. These are your coalition of the willing. These are alliances. And we must build alliances. And when alliance is built in public health, it is built on the principles of trust. I am not scared that if I show something here, somebody will cheat or somebody. No, you do this stuff so that you can share the knowledge. And if somebody takes that knowledge and it can help others, that's the best way to deliver knowledge. Best way to deliver knowledge. So I invite some of you to see if they would love to be part of this. I will tell you, we are not just a research based organization. Every single research, every single, has been translated into a community program. It's not limited to publication. It's not limited to book. It's not limited to like, okay, find a amazing PowerPoint presentation at a conference. No, no, no. We've translated everything. So everything must translate. I will not go through these initiatives, but I really want to let you know that the operationalization of your programs is a critical pillar to your research. If a research output is not generating knowledge that can be used by people for their own health and well-being, I'm sorry, this is my personal opinion. I don't value that research. I just don't value that. So, this is our training program. I wanted to only highlight this program, not because I am here to advertise the program. I don't need to advertise the program, and neither I do advertise. But 5 years ago, we had a pilot with Panimla Medical College to launch our first physician researcher program. And if you go in 2013, you can search my name, Ashish Joshi, Operational Research, and Times of India. In 2013, this program was proposed, and I had no adopters except one medical college in Chennai. And then after 6 months, I shut the program down. I was told, why did you shut the program? No, I can't because I'm the only person who's teaching. So I don't know how to, I'm not just going to get students and not have a good teachers. And today I'm very delighted to share with you that the first cohort of undergraduate medical students and nursing students will be graduating coming May of 2026 after 5 years of the first implementation cohort in a medical college. So we will have our first batch of medical college students graduating with 5 years of these outlined curriculum that has been taught to them in year 1, 2, 3, 4, 5. And it's a moment of fulfillment, a lot of pride that the students you met 5 years ago, and last week was in India, and I came just for 3 days to meet these students, and now we are doing a convocation in May, and we are actually publishing a book with the achievements of these students. And I was surprised when I was told
There's 43 papers have been published by these undergraduate students in international peer-reviewed journals. 100 research presentations in international conferences, several STS scholarships. So that gives you satisfaction that capacity building of research at an undergraduate level is a very critical component. Uh, Lastly, to give you some examples of our technology. So you heard about one, youth, you heard about research capacity, and you heard about diplomacy. And the last Venn diagram to me is technology. So we do a lot of work in the urban slums. This is the first SDG dashboard for primary data collection on urban slums in Delhi. This was presented in 2019 in the United Nations, and since then we've been continuing this study. We just got recently funded by ICMR to do metabolic syndrome study, and this was a work because of the work that we've done already since 2016. And in 2015 is when SDG goals were introduced. So that shows you that it's not about just creating, it's not about just using AI or the tools, it's about creating the data that is meaningful way informing the audiences. I'll show this one quick example. This is our health ATM. This was started in 2010 as a proof of concept in Odisha, and then 11, 12, nothing could be done. 13, we were able to do something small. 14, 15, 16 was a failure. I still kept on persisting. And today I can tell you that until 2017 or 18, I don't remember right now, that in that year, this was the product that was selected as a Digital Commonwealth Award winner for the whole Commonwealth as a solution that could actually help chronic NCDs. And so far now we have screened about 18,000 people. So think of this way, that I lost my father when I was in a medical school. Of the 18,000 people, 40% did not knew that they have hypertension or diabetes. Imagine if one person was told, you must monitor your blood pressure, you're not doing it, you've never done it, and that person starts to monitor. And imagine that that person goes to your doctor and starts taking medication. You've saved a family. And that's public health. So it's about making a difference and changing the lives of the people. So during COVID, India never had a COVID-19 tracker. I'm very boldly saying that. I'm very proud to say that we are the only entity that actually created the whole tracker for the entire nation with zero resource, zero funding, but with the support of 100 interns and our team who came together to build this first tracker for the whole country to track every policy, helplines. This is our India's dashboard. It took us whole lot of a thing to build this platform across the nation. And to be honest, obviously this is not we are not like comparing ourselves to New York Times, but this was something meaningful that could help the common person to understand how the trends are. And obviously now we are trying to convert this into a pandemic response. So every pandemic that or epidemic that's happening or outbreak that's happening, whether it's long COVID, or you want to call it as avian influenza here in the US or whatever, we are trying to now kind of make this from a COVID-19 platform to a kind of a pandemic tracking platform. So I invite others who are here to see how best we can actually use this. I'm not asking for any resource even. I'm just saying that knowledge must be shared and pooled so that it can give the benefit to everybody. I can't go everywhere and I should not be going everywhere. There are other places out there. So we make partnerships. That's the reason we make partnerships. So lastly, we measure impact of the SMART at multiple levels, social levels, over the last several years, we've created jobs. So it's an economic impact. We've trained students who have attained jobs. That's an economic impact. We've gone to the community. That's a social impact. We've actually introduced preventive practices that are health level impact. And obviously there's a data level impact, which means it's a continuing process. It's not just one time process. Uh, this is the way forward. I want to just conclude my last slide. More research is needed to know which public health innovative initiatives are most cost effective. Not just more research is needed. More research is needed to find cost effective innovations. Cross sector, cross institutional collaboration must be introduced to students, to professionals, to practitioners. If we don't know how to communicate public health to non-health sector, very, very difficult for us to make a difference. We need to build evidence templates that can be applied across various realms of public health. Public health has so many pathways, so many concentrations, so many tracks today. And I'm sure that the next month is all about public health concentration tracks that I'm going to be talking about. Need for public health leaders. I don't want to talk about workforce. I want leadership. We want to nurture leaders in public health with skills in systems thinking, effective communicators, innovators, passionate mission. We need to teach passion. Most of the sometimes people come, they say, oh, it's a 9 to 5 job. I can't work for 1 more hour. What the heck is that you can't work for 1 more hour? Public health is all about calling. It's not about just a job, guys. It's a mission. We came to public health because we have the heart to help people. We didn't came to public health because it pays us lakhs of rupees. So hopefully, we must have the ability to teach them to be empathetic and resilient in an era of this. Lastly, is this easy? No. Is it doable? Of course, yeah. So I always use the word obstructions, opportunity, innovation, struggle. You will always be considered an outlier. That's okay. It's perfectly fine to be a good outlier. No worries about that. But I just want to take a moment to thank you all. I know it is almost 12 o'clock in my night here, but I hope that you found this something useful. And if there's something that I might have said that's not, that has in any way uh, not been received well, I apologize, but I speak my heart. And I'm sure that if there are questions, I will be happy to address. But thank you for your attention out over here.
I would like to extend my thanks to Dr. Ashish Joshi for such a insightful and thought-provoking session. From underscoring the dynamic and ever-evolving environment around us, whether we speak about the workforce needs, social determinants of health, political or economic norms, to the innovative areas in the public health, while surely emphasizing on the research-based solutions, sharing the public health diplomacy. Your perspective have truly enriched our audience. And what does it mean to reimagine the public health in today's rapidly evolving the world? Now I request the participants, the floor is open. You can ask the question, you may go ahead. We welcome your thoughts and queries related to the session we had. You can raise your hand or you can unmute yourself and you can go ahead. Thank you.
Dr. Priyanka, can I go?
Yes, please, please, please.
Hello. Good late night, good evening, good evening, Dr. Ashish, and good morning to everybody here in India. Let me first start congratulating you. It's Dr. Mubashir here, if you don't have your
Yeah, Dr. Mubashir.
Yeah,
Yes,
so
yes,
let me
yes. I'm
first
trying to
start.
find somewhere.
Let me start first with congratulating you for this wonderful series that you have started. Very apt, very important. When our students come, the first thing I ask them is, why have you joined public health? And very few of them really know that why they are here and what they want to do. Most of them just happen to be here. They have explored various options, and this is where they landed. So this, I hope everybody who was listening, especially students and middle career level, I hope it inspires you. Dr. Ashish has shown you just now that how diverse public health is. When I ask someone to define public health, it's a very tricky thing. And then how Dr. Ashish has his own definitions, my definition is anything under the sun that affects the health of people. So it's so diverse, it's everything. And it's very important right now to bring it all together. So like he mentioned, the intersectoral, interdisciplinary, but also diplomacy, which I know Ashish and I have been talking for some time about it. And he's been doing excellent job. We are your partners, and we would really like to join hands on. You were inviting to join for, high school public health, taking public health to high school. Yes, we would love to join that. We're doing a lot of work in schools with school children on public health education, but to have a concrete curriculum is something very interesting and exciting, and we love to see how it is and if we can do it here. Once again, congratulations. And yes, your passion shows at midnight you are there awake trying to address all public health people and giving them a new insight and telling them how vast it is where they can go. There's so much you can do and excel in and do really meaningful. But I will iterate his words. Passion is very important. I think that's where Ashish and I have the commonality. When we first met, it's the passion for public health that drives everything. So don't lose that. And thank you very much.
Thank you, Dr. Mubashir. Thank you so much. So I have put my email in the chat box. You should not feel any kind of hesitation. Trust me, you can always reach out to me in any way. And as many people of you succeed, public health needs a very large number of people. A lot of people are needed in public health. And please remember, not public health cannot be done by one. It cannot be. It's a very large team of good people, committed people which are needed. So if there is no more question, then I put my email so that you can email me with any of your queries or thought process, because my day this morning started at actually around 4:30 in the morning, and I had sent Dr. Priyanka an email, which I hated to do that. I said I'm stuck in some extremely important meeting, and that meeting was supposed to end at 9:30 in the night. And I said, okay, if I drive now, I will hopefully reach by 10 o'clock to attend this. Otherwise, I will have to take it from the car. And I don't have my presentation, and I don't need a presentation, but at least others need the presentation. So I will say one big thing which I did. I actually drove pretty fast today to be at this lecture. So that's not very healthy public health, but sometimes we have to do to make things come along. It's such a pleasure to have you all. Thank you so much. And I hope that our paths cross at one point sometime. But this is a monthly series. I've picked topics that you will normally not hear about public health in. And I hope that this knowledge can be infused in any way somebody can use it in whatever format. But I'm just humbled to be here among you all. So thank you. And thank you, Dr. Priyanka. And thank you, the entire FHTS team who has been very rock solid standing with me for many, many years. And for those who have been recently joining. So I wish you all the good luck, and hopefully these series becomes a part of our own DNA, you know. So thank you all. Have a wonderful good morning, wonderful day, but good night from my side. And I'll see you guys next month. Unless I hear from you in my email, you'll definitely hear back from me if a query comes, okay? And thank you, Dr. Mubashir. I didn't know, but I wanted to give a shout out to you to let people know that you were one of the early people, and I do remember and I recognize and I appreciate that. Thank you all.
Thank you.
Thank you so much, sir. I request all the participants, you can fill out the feedback form which will be shared by the end of the today. Towards the end, I would like to thank all the participants, facilitator, and experts for their active presence and engagement throughout the session. Your enthusiasm and curiosity continue to inspire meaningful conversations and collaborative learning. We look forward to continued engagement in our upcoming discussions and initiative from next month. Thank you so much and have a nice voting day. Thank you.